I'm very happy to invite Professor Michael Chopp here on the stage. We sit here, wherever you want. Please have a seat. Yeah. So please have a seat. And I'm sure you all know Professor Michael Chopp. He has a very long way to come to Poland from Detroit, Michigan, from the Henry Ford Hospital. And as you heard his lectures, he's since ever I feel part of the trauma and the stroke guys and their conferences. So, and being in Krakow, a wonderful city, and I think you have familiar bands here, I've heard, and it is also the city of Copernicus. You remember Mr. Nicolaus Copernicus?
That's
yes.
Right.
And 480 years ago, in 1543, he published his heliocentric theory, and he made groundbreaking changes in the world. So not transfer this to the AMN.
Ah, perfect.
What are the groundbreaking ideas we can take from this Congress with us?
Okay, that is brilliant. It's illuminating. Maybe before I get into a whole harangue about this, I just want to express my feelings and my solidarity with the people of Ukraine. I was really very moved by the prior Professor Hook being interviewed, and I just feel that it's extremely important that this is communicated to the world, what's going on, and we just stand in solidarity with him and the people of the Ukraine. I think the metaphor of heliocentric theory that was Copernicus brought to Europe, even though the Persians knew it thousands of years ago, Central Asia, but in Europe is a little behind, so it's difficult for Europeans to acknowledge that. But I think the AMN should really function as the sun. What should happen is that when you have a multidisciplinary organization for neurotraumatology, at least from my presentation, what I wanted to communicate, is that when you have a traumatic injury to the brain, you are clearly impacting. The brain is communicating to the heart, to the gut, to the liver, and the recovery of the patient really depends on what's happening to the totality of all the organs in that body that's responding. So the center of neurorestaurology should be the AMN. The AMN has to generate this planetary network of organizations, whether it's the GI people, the cardiologists. They really have to be heliocentric around the AMN, and we have to attract them to this organization. We have to communicate to the medical community that when you have a neural injury in terms of neurologic recovery, you have to treat the entire patient. The cardiologists have to be involved. I mentioned something about fatty liver disease, and if you really press me, I'll tell you that if you have a post-traumatic brain injury and you do a fecal transplant from that patient, which is my rat, to a healthy rat, the healthy rat will have PTSD. So the point is you have to get the GI specialists, you have to attract people from a multidisciplinary, not only the neurologists and the neurosurgeons and the trauma people who are in this audience. I think we have to expand the universe of medicine to revolve around the AMN.
This is very interesting what you're telling us, because you say everything is interconnected, but who are the messengers? Who are the messengers? I think.
Do we have an hour? You're hungry, right?
No, make it
Okay.
straight and simple. you were focusing your studies on those messengers.
Yes.
Like mRNA, exosomes, extracellular exosomes. Tell us a little bit about these little things that run through our veins and our arteries and between the cells. How do they communicate? What do we know about them? And most of all, can we use them therapeutically?
Yes. Okay, that's the answer. Okay, what we know, just a touch of background, and I alluded to this in my presentation yesterday, when we started doing stem cell therapy, a couple of years later, we realized that the stem cells, again, stimulate neurologic recovery by communicating, and they do this by sending out nanoparticles that contain master molecular switches called non-coding RNAs, particularly microRNAs and multiple proteins. And this now has been extremely well characterized in the literature by us and many others, that these particles that contain these master molecular switches that regulate multiplicity of molecular pathways and that are protected by two lipid layers are essential for intercellular communication. So what we've shown is that after you have a traumatic brain injury or after you have a stroke, if I take the particles that are emanating from that brain, and I take those particles and give those particles, I showed you some data yesterday, give those particles to a healthy animal, that healthy animal will develop cardiac dysfunction and multiple secondary organ dysfunction. So that is, and I then demonstrated that the cognitive dysfunction in these animals that are subject to stroke or traumatic brain injury very much depends on what's happening in the secondary organ. And I showed you just data from the heart. So essentially, the brain is communicating by sending out these toxic messengers, these toxic particles. It is telling the heart, the liver, the gut to change, to respond. It stimulates the inflammatory response in all these organs, which then feed back into the brain and perpetuate and extend and exacerbate injury. And that's why, we heard wonderful presentations on depression, neuropsychiatric issues, post-traumatic brain injury. And these pathologies evolve over time. They develop, they first become apparent well after the onset of the traumatic brain injury. And the reason this occurs is because there's the feedback. Again, I mentioned the story with the gut and with the heart. It takes a while. The gut and the heart then send signals, and the liver also, sends signals back into the brain, and you perpetuate and you evolve and you progress this pathology, which results in depression and cognitive dysfunction.
So what you basically say is heal the brain, the rest will follow.
What happens with the brain is that the brain, as I showed yesterday, also causes vascular dysfunction.
This would be my next question.
See, I can read your mind. When I say that the brain communicates, you should ask me, what do I mean by the brain communicates? Which cells in the brain? The astrocytes, the microglia, the vascular cells? Well, essentially, it's the vasculature plays a primary role in this communication. So the vasculature in the brain after a trauma or after a stroke sends out these evil particles, these evil signals that causes downstream vascular dysfunction, and then also it doesn't stop when you get to the neck here. It goes down into spreads out throughout the entire body. So to a large extent, it's a vascular dysfunction that's being initiated at the onset of the neural injury.
And what are the key players from the vasculature, the vascular endothelial growth factors, TNF-alpha? What kind microsome? What are the key players in the damage to the vasculature, or is there overlap with restoration of the vasculature? Is there an interplay?
Well, exactly why. When you have, we've shown that the endothelial cell in after stroke and traumatic brain injury, and I'm not only there are other contributors, but the endothelial cell plays a primary role in mediating. The endothelial cell is damaged. The endothelial cell then sends out these particles, these extracellular vesicles. Many of them are exosomes. The definition of an exosome will require another lecture, maybe. How do you distinguish? It's a subpopulation of extracellular vesicles. And these exosomes and extracellular vesicles cause chronic downstream vascular problems. That's why stroke and traumatic brain injury become risk factors for subsequent stroke, and dementia and traumatic brain injury becomes a risk factor for Alzheimer's disease and dementia, not only because of the vasculature, because also you're impacting the liver, which also impacts the amyloid production in the brain. You're impacting the gut. The gut actually is the major source of serotonin. That's where serotonin is produced. That then impacts the brain. That impacts, therefore, results in depression.
You have done a lot of investigations in animals. I wonder, and you have a lot of experience with stroke and TBI.
Yeah.
We know that in stroke we have this sensible phase, this biological phase of heightened responsibility. And we can see it clearly, and there are a lot of studies there. Is there an equivalent in TBI, and are the processes similar, or is this a completely different thing in kind of when do we need therapy, kind therapy? So we want to know, is there a sensitive phase after TBI? Is it different from that of stroke? Are the mechanisms completely different? Or is there something similar you have been seeing if you put a lesion in stroke or put a lesion in TBI to your study animals?
We see a commonality in both stroke and TBI in terms of the secondary organ impact. We also show that we can treat the secondary organ impact, both in stroke and TBI, with healthy exosomes from healthy vascular cells. I've also shown, because I'm looking at Axel now, we've also shown that when we take certain pharmacologic agents like cerebrolizin, what the cerebrolizin does is stimulate the production of restorative exosomes, and that really show very potent therapeutic effect. So if I take those secondary exosomes from cerebrolizin, stimulate endothelial cells, I can restore vascular integrity.
So you can repair even the blood-brain barrier? I think there was some data you...
Not only, I'm going to interrupt you because I'm a New Yorker and I can't, so it's not only the blood-brain barrier. The blood-brain barrier is extremely important, but it's really an indication of a screwed up vasculature, of a vasculature that's highly pro-inflammatory, a vasculature that is sending out toxic signals, toxic pro-inflammatory cytokines, making the downstream and communicating to the body, let's create inflammation, chronic inflammation, prothrombosis, etc., systemically.
So let's make a shift to another topic, to the AMN and the closing of the AMN Congress. there is a lot of things going on with this AMN society because they are very active in different countries of the world, and we are now trying to expand our activities, and we are currently working on the setup of new guidelines. New guidelines in the treatment of TBI from acute to rehabilitation with several affiliated societies. From your point of view, what should be the topics? What should be the main themes that should be discussed in these guidelines? What would you recommend? Look at this theme, at this topic, or on that.
Okay, I'll go back to my original statement and your wonderful comment about Copernicus. I think the AMN should really be the hub for attracting, for integrating medical treatment, for a multidisciplinary medical treatment for traumatic brain injury. We have to not only have the people in this audience who are neuro-focused, we have to attract others. We have to communicate, we have to tell again the cardiologists and the GI specialists that you are involved in neurotraumatology. You play a critical role in the care, in the potential care of that patient, because you are changing the epithelial lining of that gut. That's going to affect how much serotonin gets into the brain. You're affecting fibrosis in the heart. Let's talk to the neurologists. Let's work together with them to treat that patient.
So we hope we will contribute still a lot of papers, important papers, to this knowledge. I want to thank you very much for this very interesting interview. I want to thank you for listening, is enduring so long. We are far out over the time. I hope you have all a very nice lunch now. And I don't know who closes the Congress, but I close this interview series. Thank you very much.
And thank you for inviting me here. I am delighted and honored to be here. Thank you.